Hey YouTube, I want to make a video today talking about testosterone, certain anabolic agents, and thick blood, for lack of a better term. So if you're here, you probably already know that testosterone and certain anabolic agents can increase your red blood cell count, the results of which can be what we call like thick blood. Let's talk a little bit about how that works. So I got a little diagram here that I've stolen off the web, and at no point is this my doing. But it's three little vials there. One on the left is normal blood, one in the middle is an anemic blood sample, and the one on the right is something we call polycythemia, which is a higher red blood cell to plasma ratio. All right. Why do you need to see that? Great question. So one of the things that certain anabolic agents and testosterone do is they increase the amount of red blood cells that you have in your body, which is good because red blood cells carry oxygen. If I have higher oxygen in my blood, I can work out harder, stronger, faster, right? Not so much. Well, that is technically kind of true on some level. It's also, there's a lot of danger around having high red blood cell counts and polycythemia. So let's say that you are taking testosterone or certain anabolic agents that are going to raise your red blood cells. Why is this a bad thing? Well, I'm going to date myself, and hopefully you guys get the reference, but there's a Simpsons episode where they tell Mr. Burns that he has like every disease known to man, and the only reason he's alive is because they're all trying to like basically kill him at the same time, and they shove a bunch of little things through a door to try and emphasize like they're all trying to get through the door at the same time. Now, that can happen if your red blood cells are too high. One of the issues with polycythemia is blood clots, right? So too much red blood cells can cause blood clots. Usually we see that as DVTs in like your legs. And then those can sometimes become blood clots that become pulmonary embolism, which is a life-threatening condition. So there's a reason that a lot of bodybuilders and powerlifters that are taking anabolics get blood clots. It's not just bad luck. The reason is a lot of these agents increase your red blood cells, and we have what's called a hematocrit ratio, which is the amount of plasma to red blood cells in your body. So looking at that diagram again, hopefully this makes sense. A normal blood cell on your left-hand side, you can see it's almost 50-50, right? That's totally okay. That's what we want. But if we are taking agents that increase our red blood cell count artificially, because your body doesn't know when it gets a signal from exogenous sources to pump up your red blood cell counts, it doesn't know to stop, right? That's the risk of taking anabolic agents or testosterone. Even government-regulated TRT can cause increased red blood cell counts, right? So it's something to kind of keep in mind. Conversation about that in a minute. So what we want to do if we are taking these things is we want to monitor our hematocrit level, because if your hematocrit level goes too high, your blood's thick, right? Which means it's, for lack of a better term, it's having difficulty getting through your veins, which your big veins, not a big problem. You know, like if we're talking about your femoral that's like the size of my thumb, you're probably going to be okay. But when you get down to the little capillaries or joints or areas where blood flow is impeded even slightly, that's where blood clots can form. So we often see, me speaking from experience, I do see powerlifters and bodybuilders coming in where they've got DVTs in their like popliteal behind their knee, right? And then the risk of that is that could thromboembolize and go to their lungs, causing a PE. You know, PEs are life-threatening if not addressed. It's not the end of the world if you get one, but at the same time, you really don't want one. So now that I've rambled on about why that's a bad thing, and then the clot burden that can come along with taking these agents, what do we do? So let's say that you are on government produced testosterone from a pharmacy, and your TRT is regulated by an endocrinologist or a doctor, and you know what you're getting is safe, right? And you've gotten your blood tested, and you know that when you take your testosterone cypionate once a week, this is what your blood value does, and it's safe and all that good jazz. Cool. You got two options available to you. The first one we'll talk about is donating blood. Now, depending on your country, I don't know how this works, so please do your due diligence, look into it, and make sure that if you are taking testosterone, you can donate blood. One of the things in Canada is when you go to donate blood, there's a questionnaire, and one of them is, have you used illegal steroids? Government issued TRT and HRT in Canada is not considered illegal steroids because it is government produced, regulated, and comes from a pharmacy. And then if you're, say, day 5 of taking your testosterone cypionate, the amount of testosterone in your blood is not going to be dangerous to somebody else. Also, at the end of the day, if you've got a car crash victim, if there's a little bit of testosterone in it from male blood, it's probably not going to be the end of the world if it's saving a life. But just look in to make sure that you can donate blood. If you can donate blood, that's a great, easy way. You're saving a life by donating blood. Trust me, I've been through many mass transfusions in the emergency room where we pump, I think the most I've ever pumped into somebody was 38 units of blood, which maybe that doesn't sound like a lot, but that's a lot of blood, like a lot of blood. He survived, which is kind of the cool part of that story. But yeah, a lot of blood. That's 38 different donors, all going to save that one guy when we pump that just nonstop blood into this guy, right? So you can save a life by donating blood. And also, when you donate blood, they're taking out whole blood. So when we looked at that ratio where it was like normal, hang on, let's do this again. You got your normal and then you got your polycythemia on the right-hand side, right? If you're polycythemic and you've got too much red blood cells and you're like, okay, but if I donate blood, Mark, isn't that same ratio still in my blood? Yes and no. You are giving over blood that is going to have a high ratio of red blood cells, or maybe it doesn't, because they do check your hemoglobin when you go to the hospital. But what I'm getting at here is, as you donate blood, you have a circulating volume of blood in your system. With male, it's like 7 to 8 liters. For female, it's like 5 to 6. If they take a pint out of you, right? If they take a unit of blood out of you, that volume is gone. And what your body does is your body can't produce red blood cells that quick, right? Which is why they tell you after you donate blood, like, don't go do strenuous exercise, don't do this, don't do that. Drink a lot of water. The reason for that, and eat salty snacks, is your body will replace that blood volume almost immediately. It's amazing at doing this. So you lose you lose a pint of blood, your body's going to reproduce that in plasma and refill in that space and that gap of that lost volume. And what that does is that dilutes your blood, and then your hematocrit ratio comes back down, right? So that's how that works. So your ratio was like this, you donate blood, and then it starts to do that. Man, I should up my production value because that was terrible. Beep. Anyways, you get what I'm saying, right? You donate blood, you then normalize that ratio so you're not polycythemic anymore. One of the reasons you can't donate blood if your hemoglobin is too low is they don't want to make you anemic, which is the opposite, which is where you donate blood and now you don't have enough red blood cells and you got too much plasma circulating. Ramifications of that are like dizziness, feeling unwell, generalized malaise. It's not great, right? Which is why they take your hemoglobin before you donate blood. And you can only donate blood so often because you have to be able to replenish those red blood cells that you've lost by donating. And in a normal person, that's fine. In those that have high red blood cell counts secondary to testosterone or anabolic use, your body's probably going to be going back to normal anyways. So that's one option. If you're on anabolics, we'll talk about it in a second. But if you're on testosterone, it's regulated, it's monitored. You know, check with your country of origin. You're saving a life. Good for you. Now let's talk about if you're on anabolics. That one becomes a little bit more difficult because there's the moral question of, is your blood safe to give to somebody? And I am not here to judge you for taking anabolics, nor do I want to judge you for taking anabolics. But what I am going to say is, when you go to donate blood, if you're donating blood that might have like test, tren, clen, equipoise, you know, maybe you're taking some T3, again, not judging you for taking it. But if that blood ends up going into like a 2-year-old, there can be ramifications for those kind of compounds, that all of a sudden they give a pint of your blood to a 2-year-old and they can't figure out why certain blood values are failing, or they might be having multisystem organ failure secondary or something, and they're confused, right? While we test blood for like HIV, AIDS, all these things, we don't test them for anabolics, at least not in Canada. I don't know about the United States. I doubt you do. So there's like that moral quandary of, okay, well, I don't want my hematocrit to go so high that I start getting blood clots, so what do? You can get something called a phlebotomy. So a phlebotomy is basically like bloodletting. If you ever seen those old pictures of medieval times where they got a guy with his arm just sitting there and they kind of cut his arm and blood just runs down into a bucket, this is the same principle, is getting a phlebotomy done. Now, we don't do that anymore. Or maybe, depending on what country you're on, you're super archaic and they do. I don't know. But what we do is you can go into a lot of different places, just do your due diligence, research and whatnot, and you can literally get somebody to take a liter off of you, right? It costs money, and I know that blood donating is free, but at the same time, like I said, it comes down to that moral question of whether you should be donating blood on anabolics, and I don't think there's any question that you probably shouldn't. Sorry. But you can pay somebody to give you a phlebotomy, where you're like, hey, I can donate blood every 8 weeks, normally. So every 8 weeks, I'm going to get a phlebotomy, and I'm going to get my blood work done to make sure that my ratios are appropriate. When you donate blood, they do test your hemoglobin, so you know what your hemoglobin is at. If you're getting a phlebotomy, they don't. So you might have to get some blood work done, and you can actually titrate the frequency of your phlebotomies around your blood work, right? And you don't need to get expensive blood work done. You just need a CBC. That's going to give you your hematocrit ratio, your red blood cells count, and your hemoglobin, right? And then you can look and see, like, if your hematocrit's at like 0.48, brilliant, don't worry about it. You don't need to get phlebotomized right now. As that starts to creep up to like 52, 53, 55, maybe that hematocrit ratio, now we want to start getting you phlebotomized, right? So you get a phlebotomy, get your blood work done, 4 or 5 weeks later, and now your ratio is like 4.48. Cool story. Don't need to get another phlebotomy, right? So that's one way that you can reduce the risk of blood clots, thick blood when you are taking anabolic agents, right? Is you're just paying a medical professional to take a pint out of you. And what do they do with the blood? They discard it. It gets incinerated because it's a biohazard. But now you've lowered your hematocrit ratio, your blood's less thick, and that reduces a little bit of that risk of getting a blood clot secondary to those use. So yeah, and I mean, heck, if you're on TRT or HRT and you don't want to donate blood because, you just don't want to, right? No judgment. You can also get a phlebotomy, obviously. You can do both. Hope that kind of explains a little bit about testosterone, anabolics, thick blood, high red blood cell counts, hematocrit, and I hope I explained that hematocrit ratio well, about how too much red blood cells, not enough plasma, thickens the blood as it's going through smaller vessels, and that's where blood clots form, and why we want that ratio to be like a specific level. If I didn't, let me know in the video down below. Be like, Mark, your videos have always sucked. Why did you come back after 3 years, dude? And I will take that to heart and try to be a little bit better down the road. If you have any questions or comments about it, post it down below. I'll do my very best to try and respond to you. That's about it for now. And as always, guys, eat like a bodybuilder and train like a powerlifter.